All right, so we'll go ahead and get started.
Sure.
So my first question is, can you tell me your full name and a description of what you do?
My name is Kwadwo Kyeremanteng. I'm the intensive care and palliative care physician at the Ottawa Hospital and Monfort Hospital. So take care of patients at the end of their life and also when they're most vulnerable and needing life support.
How has your work changed because of the pandemic?
Yeah, my work has changed in so many ways. Like I think when we look at the beginning of the pandemic, our day to day, we don't live in fear of how of getting sick or being at risk at our own jobs. Like there's been instances, but it's not a predominant part of our job. So when we started to look into the pandemic and waiting for our first patients to roll in, we were scared. We were intimidated. We Are we going to get sick? Are we going to pass it along to our family? Are we going to get overwhelmed? And so there was a real tension, a real high level of anxiety throughout the pandemic or throughout the at the beginning of the pandemic. And so that changed, that was a challenging part in terms of the mindset. And the other thing too is like we were taking on a novel virus, so we had to be quick to adapt. We had to be quick to learn what is the best way to treat our patients. What's the best way to give them the best chance of survival. And so these, therapies and interventions changed throughout the pandemic, and we had to be willing to adapt and like to learn. And that was a massive challenge. And it's luckily our teams are so dedicated. They're so wanting to do the right thing, wanting to do best serve our patients as much we can. So the learning, the extra time to make sure that we're keeping or that we're protecting our patients, all those efforts, everyone put in their overtime to make sure that we all can get through this. It's been so incredible. But yeah, the job has changed quite a bit. But we've as a result, though, we're like a group now that is, I would say, we're closer than we've ever been because we've had that common goal of helping our citizens get through this pandemic. And when you have a whole, nation behind you, rallying behind you and thanking you for being just doing your job, like it's been in that way, it's been incredible.
Yeah, I can imagine. How has it changed your family life and your personal life when you, for instance, when you go home at the end of your shift, and not only in terms of having to make sure that you are doing all the washing your hands and probably changing your clothes and all that. Has it changed sort of your personal views in any way?
Yeah, it's changed in a sense, like the nature of my job. You always kind of you don't take life for granted, but there's times where you'd have a tough day in terms of you see a COVID patient that, especially at the beginning would die alone. Like a person that was lived their whole life to serve and be there for their family and be an outstanding citizen. And because of the nature of the disease and protecting others, like dying alone is tragic. And, so some days you come home and you hug your little ones a little bit tighter and your wife a little bit tighter. And um, yeah, in some ways, that was a heavy reminder of like not to take life for granted and your loved ones for granted. You really got to make sure to protect your family. You don't want to bring that. You don't want to bring COVID home. Especially we have a caregiver that was immunocompromised, and so you're always thinking like like make sure you're keeping all of your family safe, and that's not that's not a typical mindset in during other times of like outside of the pandemic. So I was cognizant that a lot of people weren't able to have that connection and community because we were all at home and isolated. And I had the gift of being able to at least go to work and have a reliable income, and being able to connect with other people going through similar circumstances. So that I think was another um, uh, epiphany throughout all this, that in some ways I've been really fortunate in my circumstance.
It's interesting that you can sort of see hope and resilience, right, through all this, with and still having to go through your shift and then seeing people who pass away and seeing your staff probably having a hard time. You spoke a little bit about the people that work around you, healthcare specialists, nurses, residents, other doctors. You commented that you've kind of come together, right? Like as a team. Do you do you have anything else to add to that in terms of how it's impacted them? Like at the beginning, was it very difficult? I'm assuming everyone was working overtime and doing what they could.
Yeah, I mean, I got to tell you, it was hard on the staff, especially early on. It was brutal in so many ways. Like you got this virus that that had a lot of unknowns, and you see a nurse having to be in a room with somebody with COVID for 12 hours, wearing all the PPE, perspiring, tired, thirsty, needing to go to the bathroom, and this was extremely tough. And there was, especially early in the pandemic, there was one of the things that I still like get emotional thinking about is some of these trainees, some of the residents that were like, "You guys are short. You know what? I'm gonna come up. I'm gonna step in. We'll help out. If you guys need us, we're there." And they saw the greater good. And for and they're early in the training, they had their whole lives ahead of them. I just every time I think about that, I'm like, wow, you guys are heroes, man. Like you guys, like I just looked at them in a different light. Like it was pretty special what they were willing to sacrifice. So yeah, it's had its up and downs, but I gotta tell you, it's been an extreme emotional roller coaster this whole pandemic.
Yeah, I can feel that. Do you remember your first COVID positive patient, or maybe your first experience with dealing with COVID? And can you share that with us?
I was there when the first COVID patient came into our intensive care unit, and we were all waiting anxiously, seeing how they were going to look, seeing how they were going to behave. I remember thinking, all right, here we go. Is this the beginning of the chaos? Um, and the beautiful thing is, you put your head down and you focus on your job and focus on what you need to do. And before you know it, patient did okay. Our team did okay. Everyone protected themselves. Nobody panicked, and the next one comes in and maybe they're a little bit sicker, but you got one under your belt you experience one other case. So your knowledge has increased that much more. And I just remember each time you'd see a new case, you'd be like, okay, we could do this. And collectively you would look around and say, you could do this. But one early case that I should mention that came to mind that really exemplified the magic our team would have is I remember I had a fairly young patient that family man, had multiple kids, real jovial guy too that you could have a conversation with and pretty laid back. And he got really sick really quick, like needing a little bit of oxygen to needing maximum oxygen, needing to put on a ventilator, and then getting the maximum amount of oxygen we could give on a ventilator and barely hanging on to life. And I remember looking at our team and we're like, this is early in the pandemic, and we're like, we can't lose somebody this young. Like this is crazy, just for obvious reasons, but even morale, like we gotta figure this out. So, we put our heads together. We he had needed to get a few procedures done, like put a dialysis catheter in, which was, if the slightest slip up would cause him unfortunately to pass. We had to flip him on his stomach. If any of the lines come apart, like it was going to be a bad outcome. Had to try and transport get some imaging done to make sure we weren't missing anything. All these things, like with a team of 12, just doing their best to try and just salvage his life. And I remember at the end of the day, when we were doing all these things and, we made it through the night and look at our team, I'm like, guys, like, you should be proud today. You should be absolutely proud. This was a true team effort. This guy's alive today because of what we did. Like, go home and sleep easy with that thought. And now this man is at home today with his family. And I can't tell you, like, when I was there, I'm like, a voice inside me was like, he might not make it. He might not make it. And this is crazy. Like, this is crazy. He's got to. But we rallied. We worked as a team. Every single person in that team had a massive impact on that person's life. And luckily now he's home today and with his family. It's something that I'll never forget, ever.
Has there been anything unexpected about the virus that has surprised you?
The thing that still, I think, attacks my heartstrings is just the fear. And so, like, sometimes even if we tell families that, their loved ones are dying and, it's safe to come in, we will make sure you're protected, that they still don't want to come in because of fear of contracting COVID. And that to me, it's a hard one to watch and listen to.
Yeah.
Are you crying? Sorry, did I do something? No, are you okay?
This is just what happens. Like, I find it so touching that, like, you go through this every day, basically, right? And it's just the stories of resilience are so touching, but yet there's stories of just complete sadness too, right?
Oh, yeah.
So it's just like being able to keep yourself together and strong for your staff and your colleagues and your patients. Like, I can imagine the emotional toll that takes, right?
People were so scared and so sad. Like, I still never will forget when one of the nurses like that I've known for a long time, and seeing her face when coming off the phone when knowing that this family member was going to die alone, and ICU nurses, the RT, the staff are tough. Like, and when you see them break down for something, it's usually like significant. Mm-hmm. And that was happening a lot especially early in the pandemic. So, I will never stop giving love to our group, because and like, they're doing it, they're in it. Like, I'm in a COVID room, but maybe 5 minutes, whereas that nurse is in there for 12 hours. Like, they deserve all the love in the world.
When you look back at the last 10 months, has there ever been a lowest point or a low point where you just you started to wonder if you guys were gonna come out of this?
For the most part, I've been reassured throughout the pandemic, because Ottawa, we've never been hit hard. We've always been in a situation where we can accommodate the increased cases. We were never overloaded. Our ICUs were never completely full with COVID that we needed to, expand our ICU, for example. And I've been so proud of our city. Like, I just been so proud of how we've handled it. This is a truly, like, the city is resilient. They by abiding by public health measures, they've kept us all safe, kept us from being overwhelmed. I personally haven't been in a situation yet where I'm like, oh man, we're in trouble. It's been that mindset of, this is what it is. We're going to get through it, through the vaccinations, through listening to public health and continuing to distance and to mask and to hand wash. We'll get through it.
So you've sort of already touched on one of my questions about what would you say to Ottawa residents, but is there anything that you would say sort of in a few sentences about your message to Ottawa and the public?
I'll say thank you, man. Like, thank you for doing your part. And I truly believe what you guys have been doing, masking, distancing, reducing those social gatherings, listening to Ottawa Public Health has made a difference, and why Ottawa has been such a leader in terms of how to get through this pandemic. So just, once again, I truly think we'll get through this, but let's stay vigilant. Let's get vaccinated, listen to our public health officials, and we'll get through this. We'll get back to normal life